Welcome to No Filter Doctor, where we cut through the health hype and dig into what's real, what works, and what's backed by evidence. I'm Dr. AK. Let's get into it. Hey everyone, welcome back. We are going to talk about an extremely popular topic today, and that is hormone therapy. Full disclosure, I've written multiple blogs about hormone therapy in terms of this full circle of how people were on it, then it was bad, and now it's good again, talking about different FDA updates about estrogen, and also talking about testosterone in men and women. But I was holding out and doing a podcast because I invited a couple other content experts to come on, and I thought it would be really cool if we could chit-chat all the data and have that in a podcast. But it appears I am still an absolute nobody in the podcasting world, and I either got ghosted or just people outright said no, and they didn't want to come on as a guest. But rather than delay discussing the topic any further, I thought, you know what, let's just get into it and let's talk about it. Now, there is a lot of content here, and I pride myself on keeping these podcasts at just about 30 minutes or less in terms of time. There is no way to cover all the content in 30 minutes or less. So what we're going to do is we're just going to go and start chatting. And once we get to about the 25-minute mark, I'm going to see where we are in terms of all of the content. And then I will follow up with the remaining information the following week. That way we can still keep things short and interesting. You are not bored to death by hearing my voice for a really long period of time, and you can still receive all of the information. All right, one other thing. Most of you that are listening are women. However, there is still a good percentage of men that are listening. And men, I do not want you to feel like this episode has nothing to do with you. 50% of the population is comprised of women. I am sure you know a woman. And imagine how you can help them by saying, hey, I learned all of these things in this podcast. Did you know about these? If yes, awesome. If not, oh, look, here's some resources that I learned about, and let's see if we can get you feeling better, someone who I really care about. So while the content is initially talking about hormone therapy in women, I think this is something that everybody should listen to because it does affect all of us. I think the best place to start is to kind of go through the history of up until now. Hormones were in, then they were out. We learned some stuff, we had to unlearn some stuff, and now we're kind of in this new age of hormone therapy for women. And that's what I'm going to focus on. And again, we'll see how far we get in terms of content and then see what topics we're going to cover next week. Now, when I was a kid, I distinctly recall my mother being on hormone therapy. She had a total abdominal hysterectomy and was taking hormones. Then all of a sudden, she just wasn't. And I remember everywhere people talking about hormones, they're dangerous and they cause cancer. And in medical school, we were taught that messing around with hormones was risky. However, the studies that initially came out and said that hormones are this great evil have been reevaluated. The data that they put out was reevaluated. And this reanalysis has led to more research. And now we're realizing that hormones really need to be reconsidered as a viable treatment option for women. And so that's kind of what I want to talk about. We're going to talk about when did this all become bad, and then what was the second look. There was a study that started in 1991, and it was called the Women's Health Initiative. It's usually abbreviated WHI when you're reading about it on different materials. And this study was designed to give us answers about what postmenopausal hormone use was associated with. Does it help with bone density? Does it increase blood clots? And there were some other secondary analyses like cardiovascular risk and stroke. And so they did the study, and in 2002, the results demonstrated that treatment with HRT in healthy postmenopausal women was linked to an increased risk of cardiovascular disease, stroke, blood clots, and breast cancer. And this is what led to that climate of caution where everyone was like, oh my gosh, hormones are terrible, they're dangerous, do not give them. And so that was it. Hormone therapy died in 2002 when this announcement was made. millions of women were abruptly taken off their hormones. And that's kind of where we lived until we started reanalyzing this women's health initiative. So critics started looking at this women's health study and looking at the methodology and looking at the participant characteristics and also looking at the data analysis and raised a lot of concerns about this study. First of all, the women who were enrolled in the study had a mean age well into their 60s. And this is often at least a decade beyond when women go into menopause. This is also the time when cardiovascular risks naturally increase. So we looked at a population who probably wouldn't even have been in the window of hormone therapy initially. And then we analyzed outcomes in this population that they were already at high risk for based on age alone. Most of the people who benefit on hormone therapy are women, usually in their mid-30s to their mid-50s. That was not the population that was used in the Women's Health Initiative. So we extracted data from a study in a population that is well above the age that people even use it, and then we took it away from everybody. Obviously, hindsight being 2020, we now know that probably wasn't the best move. There was some interesting reanalysis when we looked at this increased risk of breast cancer, which is really one of the main things that drove the whole no hormones for anybody anymore. So this increased risk of breast cancer was confined to a very, very small subset of women who were receiving the combined estrogen-progesterone regimen. And that increased risk was all of 1% above what the already existing risk was in this age demographic. And that 1% risk, it was only seen in that estrogen-progesterone regimen. So something that you need to know about hormone therapy is if you have a uterus, you cannot just be on estrogen alone. And it has to do with the fact that the estrogen allows the endometrial lining of the uterus to keep building. Progesterone keeps that under control. So when you have estrogen and you are administering that to someone who has an intact uterus without any progesterone, they are going to keep building that endometrial lining. And that can lead to a higher risk of a certain kind of uterine cancer that can happen. So in order to prevent that, people who have a uterus are on estrogen and progesterone. So the increased risk was seen in those individuals, the people who had the estrogen-progesterone combo. The women in the study who had undergone hysterectomy and received estrogen-only therapy, they did not exhibit that 1% increased risk of breast cancer. However, it was estrogen that received the black box warning that had to do with cancer. The other issue was there appeared to be an increased risk of blood clot that had to do with things like heart attack and stroke. And so that also led to a black box warning. In fact, the exact verbiage was, in all caps, warning, endometrial cancer, cardiovascular disorders, probable dementia, and breast cancer. That is what got put on the side of every single estrogen-containing medication. We then started finding out a little bit more information when it comes to the blood clot risk. So there was a study published in BMJ, the British Medical Journal, in 2008 that reported it's not necessarily the estrogen, it's the route of administration. And we figured out that oral estrogens are the ones that have the increased risk of blood clot formation. So there's something called the first pass effect, and we've talked about this before. When you eat a medication, like you take it orally and it goes into your stomach, it gets absorbed right there in your stomach and it immediately goes to the liver because that's how the blood flow is designed. When things go through the liver, it goes under a modification, and that modification is called the first pass effect. And so what we learned about estrogen is that the oral formulations are the ones that are associated with the higher risk of blood clot because of that first pass effect. But that black box warning continued to stay on every estrogen product. With this updated information came other studies that started telling us, you know what, that WHI study that you guys ended all hormone therapy over, there are some other things that we don't think it got right. One of those things is cardiovascular disease. A 2015 Cochrane review found that women who started menopause hormone therapy less than 10 years after menopause had a lower risk of coronary artery disease compared to placebo. Another study that was published in the New England Journal in 2016 looked at the vascular effects of early versus late postmenopausal treatments with estradiol, and they found that there was a benefit in the carotid artery, so the artery that comes off the top of your aorta and goes up to your brain, had improved benefits when estradiol therapy was started in early postmenopausal treatment. Those women, their average age in that group was 55.4 years of age. In fact, the American Heart Association published a statement in the journal that's called Circulation in 2020, where they reported that a meta-analysis of randomized trials showed menopause hormone therapy may decrease coronary heart disease and all-cause mortality by 30 to 48% when initiated in women younger than 60 years of age or within 10 years since menopause. They went on to discuss a meta-analysis of randomized trials in young postmenopausal women suggesting a 27% reduction in mortality in those patients who are on menopause hormone therapy compared to no treatment at all. That concern for increased dementia, we have since figured out that may also be incorrect. There was a 2025 systematic review and meta-analysis that found that menopause hormone therapy use or initiation within 5 years of menopause was associated with a reduced risk of Alzheimer's dementia. There was another study that came out that said oral estrogen-only therapy was the most protective. And then another meta-analysis found similar findings, again, with estrogen-only therapy, and the greatest benefit was with earlier initiation of the menopause hormone therapy. It kind of doubles down on the nonsense of that black box warning about increased dementia risk on estrogen. And the research just continues to grow from there. We're now finding out that menopause hormone therapy could possibly improve depressive and anxiety symptoms in peri- and postmenopausal women. One area that has consistently been beneficial, even from the WHI, is bone density. Hormone therapy has been shown to reduce the risk of osteoporosis and associated fractures in women. I mean, that's just something that we know. So, I've talked about my fear of being a little old lady who falls and breaks her hip. Hormone therapy helps reduce the incidence of those fractures. So we've gone from don't use hormone therapy because it'll increase your breast cancer, it'll cause heart problems, it'll cause a stroke, it'll make you demented, to, hey, guess what? We were actually very wrong. And we found that you're really only going to have an increased risk of blood clot if you use oral estrogen. Transdermal and vaginal estrogen are fine. In addition to that, we don't have to worry about breast cancer that same way. Cardiovascular disease, hormones might actually be protective. Same with dementia. Yet, we still had that black box warning on estrogen-containing medications, and people were freaking out about taking it. And, there were a lot of doctors out there who were really worried about prescribing it. And I can't blame them. When you go through all of your medical school being indoctrinated that starting hormones is dangerous and you, quote, shouldn't mess with that, that's actually what one of my professors in med school told me. Don't mess with hormones. Those are bad things. When you're indoctrinated while you're in this very vulnerable learning part of your medical school experience, you are going to have some hesitation kind of shifting your mindset based on these other studies that come out. And I'm not going to get on a full soapbox and go on a tirade about how women's health is very poorly researched, because it is. But I will say that now that we're starting to get a little bit more research, we are starting to learn more things. And thankfully, the FDA did end up removing that black box warning from many estrogen-containing medications. So what exactly happened there? Well, by the early 2010s, these WHI investigators and independent experts were publishing articles noting that the risks were actually much lower than the benefits with estrogen therapy, especially when it was initiated in women under 60 years of age or within 10 years of menopause onset. They also noted that estrogen alone did not increase that breast cancer risk and might even reduce it. This led to a push to revise the FDA black box warning. A petition was filed in 2016, but then it was denied in 2018. So the fight continued, and more people became vocal about this. There were a lot of women, Urogyne physicians like Rachel Rubin, Kelly Casperson is another one, several other OBGYNs who met with Congress and did all of these things to try and get this black box removed. In early 2025, several professional groups submitted formal letters and position statements basically saying like, listen, these things that are written in the black box, they are not correct. So the FDA then held an expert panel meeting on July 17th of 2025. That meeting ultimately led to the removal of the boxed warning from transdermal and vaginal estrogens and the modification to the warning for oral estrogens. It took years of data, advocacy, and persistence, but finally in November of 2025, that black box warning got removed, and it really did open up the gate for women to start receiving hormone therapy again. They were able to receive the hormone therapy before this, but removing that black box, if you want to think about it, there was like a psychological shackle on people not wanting to start these medications because of that black box warning. Even though the data didn't change, the comfort level with being on the hormones significantly changed, as did the comfort with prescribing them. And one other very important factor that we haven't discussed yet is the fact that hormone therapy looks very different than it did when the WHI study first made headlines. The treatments that are available now are safer, better studied, and far more individualized than anything that existed 2 decades ago. And keeping that black box warning on everything just prevented people from accessing that care. I mean, one of the biggest shifts has been moving away from older oral estrogen formulations and towards more transdermal and vaginal options. Both of these options bypass the liver. They do not carry that same clotting risk that we see with oral estrogen. And vaginal estrogen is especially important to highlight because it's safe for nearly everyone. I mean, if you've had breast cancer, vaginal estrogen is safe. So there's a lot out there in terms of the different hormone therapies that are available, and removing this FDA black box from them has really just opened the door to women now receiving the care that they really should have been receiving for the last 20 years. We have so much more to talk about on this topic, like when do you get labs? When do you not get labs? What are the symptoms? Because there were a lot of traditional symptoms that we know about, like the hot flashes and the night sweats. But there's a lot of non-traditional symptoms that we're learning about with more research. We have different kinds of information to discuss about the drugs in terms of what does bioidentical mean? What is the role of compounding pharmacies? What is the role of pellets? Still so much stuff to talk about, and we are at the 18-minute mark. There is zero chance I'm going to be able to get all of that stuff covered in a timely fashion. So rather than drone on, I'm going to end things here, and in the next podcast next week, we will talk about some more of these issues, and I'm going to still hold out hope that maybe somebody that I invite to come on this podcast will say yes between now and then. Until then, I hope you all have a good rest of your week, and I will talk to you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter, where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.